Hello everyone and welcome back to the House of Homeo Ed. Today let's talk about acute cases. Now we're going to be understanding what is an acute case firstly. As per the organon, what our master has taught us, acute cases are those that have a sudden onset, they have a rapid progress, their duration is more or less fixed, it is usually a moderate duration, and they can end in either recovery or death. Now with this understanding, we have to gauge that an acute case has to be dealt with in a slightly different manner than we would deal with a chronic case. So in the next reel, we're going to be talking about an acute case taking in detail. Now let me tell you, an acute case is like a 100-meter sprint. You got to be fast, but you got to be accurate as well. Okay, so when do we start and how do we start a race? We started from the first starting point. Take your patient back to the starting point. Ask your patient the first symptom that he or she had. Okay, get that symptom properly. For example, a patient talks of a cold. A cold can be a nose block, can be sneezing, can be coryza. So get that. Get the proper understanding. If it is a coryza, okay, get the discharge, get the quality of discharge. Okay, ask the patient the evolution of symptoms. Ask the patient what happened after the coryza and what happened after that symptom. Get that picture properly. Write that down in your case record properly. Ask the patient how quickly or how much time did these symptoms take to manifest themselves. It can be a few hours to a few days. That helps you to rule out slow acting and quick acting remedies. Okay. Get also a prodrome from your patient. Now a prodrome is any change that a patient has before the onset of the actual clinical symptoms. Yeah. Get the ailments from. I need not tell you how important it is to understand the ailments from in any case. Now that you have your evolution in place, get into trying to get the modalities, any sensation, any concomitant there. Now modalities can be modalities of time or modalities of circumstance. You have to gauge that from your patient. You have to ask your patient. For example, nose block. When is the nose block more? Any time of the day or night. Any position when sleeping, sitting, lying down in a particular position. When is the nose block more? Get that from your patient. What do I mean by concomitants? And what kind of concomitants you must think of? Okay. You can have a lot of headache. You can have a lot of body ache. You can have changes at the level of the eyes. You can have changes at the level of the taste for food and water. Ask your patient and also ask your patient at what symptom did these concomitants come. For example, you can have headache with a coryza and headache with a cough and headache with fever. So make sure you are asking your patient very, very clearly. Okay. When you're talking of changes in taste, now these changes in taste can happen even because of any particular medication. So make sure you are confirming with your patient that this change has happened not because of the medication but as a spontaneous effect of the acute illness. Okay, and make sure you are asking about changes in taste for food and water separately. We ended with the changes in taste. Now let's talk about changes at the level of the generals. Now these changes can be energy level, appetite, thirst, sleep, urine, any new craving, new aversion, okay, changes in the sleep pattern, changes in the perspiration, any particular dream scene at that time. Okay, so make sure you are asking about all this. Yeah, please do not consider chronic symptoms over here. A craving for spicy of the same intensity in chronic as well as in acute, for example, holds no value. Okay. Talk about and ask about changes in thermals. Yeah. Whether the patient is more chilly or is now moving towards hot. Okay. Get that. Next, talk about changes at the level of the mind, behavior and emotions both. So make sure that is something that also you consider. After you're done with all this, please examine your patient. General, local and systemic examinations all are a must. Okay. You are supposed to remember that there is going to be an alteration of the pulse level and also the respiratory rate with a rise in body temperature. Yeah. Look at the tongue. Now let me give you why is examination important. Not just for diagnosis but also for your remedy. For example, you have the patient who is saying that there is cold, cough, fever, and you examine the throat and you see that there is a lot of congestion in the throat. Tonsils are enlarged, yeah. But the patient is 100% telling you that there is no pain, there is no irritation, there is no discomfort, and he's not even taken any medication for it. Then you will think of drugs that have an analgesic effect, yeah. When there was supposed to be pain, there is no pain, yeah. So that is also something that will help you. Looking at the tongue will help you to come to a smaller group of remedies. Now with all this, you must be able to make a totality. Now to make a totality, you are supposed to be giving grading to your symptoms. Make sure that all your symptoms that you have seen in your patient have been given marks by you. You decide the marks as per the circumspection that you've done and the intensity by which the patient is complaining. Now the totality is only the acute symptoms. I'm telling you that chronic features will not feature in the acute totality. Yeah. Your acute totality need not start with the causation or the ailments from. Even a physical particular but of utmost importance can be your number one symptom in the acute totality. Yeah. And when it comes to choosing a remedy, refer to your repertory, refer to your materia medica, and you'll be able to choose that acute similimum for your patient. And in an acute, you will need to repeat. So choose your potency of the similimum accordingly. With that, I have concised an acute case taking for you. Hope this helps. Thank you.